Have you ever walked into a room and forgotten why you went there or misplaced your keys, only to find them in the refrigerator? Or maybe someone close to you, your spouse. Your parent has started repeating the same stories, mixing up names, forgetting appointments, and deep down, a question starts to form. Is this just aging, or is it something more? It's a question I've heard thousands of times in my 30 years as a brain doctor, and let me tell you the truth. Most people don't hear soon enough. Not all memory loss is Alzheimer's. In fact, many causes of forgetfulness in older adults are completely treatable if we catch them early. Memory is like the warning light on your dashboard. It doesn't tell you what's wrong, just that something needs attention. And sometimes it's not the engine, it's just low fuel or a loose cap. That's what we're going to talk about today. Because according to Mayo Clinic and the National Institute on Aging, conditions like thyroid problems, sleep disorders, vitamin deficiencies, and even stress can cause memory loss that looks like dementia but isn't. So don't panic, but don't ignore it either. Today, I'll walk you through the 10 most common and most overlooked causes of memory loss in people over 60. You'll learn what's normal, what's not, and what simple actions could help bring clarity back. But before we start, let me ask you this. Have you ever seen someone's memory get worse and then get better again? Comment yes or not sure below, because your story might give hope to someone else. Let's begin with clarity, with calm, and with care. Number 1, what's normal forgetfulness? After 60 and what isn't? Let's clear something up, because not every lapse in memory is a reason to worry. The truth is, some forgetfulness is normal as we age. Why? Because the brain, like the rest of the body, changes over time. We don't run as fast, and we don't recall as fast either. That doesn't mean we're sick. It means we're human. So what does normal age-related forgetfulness look like? Occasionally forgetting names, but remembering them later. Misplacing items now and then. Taking a little longer to recall a word or detail. Occasionally missing an appointment, but realizing it afterward. Needing reminders for new tasks, not familiar ones. These things happen to almost everyone over 60, and they often respond well to rest, structure, and routine. But then there's a different kind of memory loss, the kind that gets worse. That begins to interfere with daily life. That changes who a person is, not just how much they remember. So, what should concern us getting lost in familiar places? Repeating the same questions minutes apart? Difficulty following simple instructions. Trouble managing finances or medications. Personality changes, withdrawal, confusion, irritability. When these signs appear, it's time to pay attention. Because this is no longer just aging. It's a signal that the brain may be struggling. And here's the key message. Memory loss is not the problem. It's the message. Our job is to listen gently, wisely, and without jumping to conclusion, because not all memory loss leads to dementia. But almost all of it deserves a closer look. Have you ever wondered, is this normal for their age, or is something more going on? Type yes, or I've asked that in the comments, because sometimes even asking the question is the beginning of healing. In the next part, we'll explore 10 causes of memory loss in the elderly, including several that are treatable, reversible, and often missed. Number 2, 10 causes of memory loss in the elderly that have nothing to do with Alzheimer's. When someone over 60 begins to forget things, our minds often jump to the worst case scenario. Is it dementia? Is it Alzheimer's? But here's what we need to remember. Memory loss is not always a disease. Sometimes it's a signal, and the root cause has nothing to do with Alzheimer's. Let's walk through 10 of the most common and most overlooked causes of memory loss in older adults, based on research from Mayo Clinic and the National Institute on Aging. And remember, many of these can be treated or reversed. 1. Sleep deprivation. Lack of deep, restful sleep affects memory storage and recall. Sleep apnea, nighttime urination, and chronic insomnia can prevent the brain from forming new memories. 2. Depression. Depression in older adults doesn't always look sad. It often shows up as fatigue, apathy, and a memory fog, making it easy to confuse with early dementia. 3. Stress and anxiety. Long-term stress elevates cortisol, which can damage the hippocampus, the brain's memory center. Anxious thoughts also interfere with concentration and recall. 4. Medication side effects. Some common medications like anticholinergics, sleep aids, and painkillers can slow thinking and blur memory. Even over-the-counter drugs can contribute. 5. Vitamin B12 deficiency. This essential vitamin supports brain and nerve function. Low B12 can lead to memory problems, confusion, and even permanent damage if left untreated. 6. Thyroid disorders. An underactive thyroid can cause forgetfulness, slowed thinking, and low mood symptoms easily mistaken for cognitive decline. 7. Alcohol and substance use. Even moderate long-term use of alcohol can shrink brain volume. Combined with age, it increases the risk of confusion and memory loss. 8. Head injury, even mild. Falls or head bumps, especially common in older adults, can cause memory issues that may take weeks or months to appear. 9. Urinary tract infections, UTIs. UTIs in older adults often present not with pain or fever, but with sudden confusion, agitation, or memory loss. This is especially true for older women. 10. Brain tumors, strokes, or vascular issues. Although less common, any disruption in blood flow or brain structure can impair memory. These causes must be ruled out through imaging and exams. The takeaway: not all memory loss is brain failure. Sometimes it's sleep, sometimes it's stressful, sometimes it's something as simple as dehydration or a medication switch. Have any of these causes surprised you? Comment "didn't know that" or "that explains a lot" below. In the next part, I'll show you what happens when we delay action and how catching memory issues early can protect independence, dignity, and life itself. Number 3, why waiting is dangerous, the silent cost of delaying a memory check. We tell ourselves it's just aging. We hope it's nothing. We wait because bringing it up feels hard and maybe a little scary. But here's what I've learned after 30 years as a brain doctor. When it comes to memory loss, time is not neutral. Every week we wait. Every month we shrug it off. We may be losing something that can still be protected, because some causes of memory loss are reversible, but only if caught early. Others, like mild cognitive impairment or early-stage dementia, can be slowed down, but not if we wait until it's too far gone. And even when the diagnosis is serious, knowing early gives the person a chance to plan, to speak, to choose, to live with clarity while there's still time. Delaying means missed opportunities for treatment. More confusion, more fear, more stress on caregivers, and sometimes irreversible loss of independence. Early detection doesn't fix everything, but it opens doors to medical help, support systems, memory care, and emotional preparation. Most importantly, it gives families the gift of time to understand each other, to say what matters, and to walk this road together. Have you or someone you love ever waited too long to ask the hard questions? Comment, "I've been there," or "learning from this." In the next part, I'll show you how to bring up memory concerns gently, respectfully, and without shame, because talking about it early is a gift. Number 4, how to talk to a loved one about their memory without causing fear or shame. Talking about memory loss with someone you love is never easy, especially when that someone is older, a parent, a spouse, or a grandparent you've looked up to your whole life. We fear hurting them. We fear upsetting them. We fear what they might say or what we might find out. But silence does not protect them. Gentle truth does. Here's how to begin the conversation with care. Respect and love. 1. Start with observation, not accusation. Say, "I've noticed lately that you've been forgetting a few things that used to be automatic. I just wanted to check in. How are you feeling about that?" Avoid words like dementia, Alzheimer's, or "you're losing it." Those trigger fear, not reflection. 2. Focus on shared concern. Make it clear that this is about both of you, not just them. Try "I love you," and "I want to make sure we catch anything early so you can stay independent and strong as long as possible." This helps shift the focus from defense to partnership. 3. Ask permission. Offer support. Say, "Would it be okay if we talked to your doctor together about some of these changes?" Or "I'd feel better if we looked into it just in case it's something easy to fix." Give them a sense of agency. Let them feel in control. 4. Be patient with their response. Some people need time. They may deny. Get irritated. Brush it off. That's okay. You've planted a seed. Come back to it later calmly, kindly, consistently. 5. Don't wait for a crisis. The best time to talk is before something scary happens, before a fall, a forgotten medication, or a lost drive home. Early conversations save dignity, and dignity protects peace. You don't have to be perfect. You just have to be present. Have you ever had to open this kind of conversation with a loved one? Comment yes, "I tried," or "I've been afraid to." In the next part, we'll talk about what happens after the conversation, what tests to ask for, and what treatments can actually help. Because memory loss isn't the end. It can be the beginning of healing, if we're brave enough to speak. Number 5, what to do next. The tests to ask for and the treatments that actually help. So you've had the conversation, you've noticed the signs, and now you're wondering what happens next. This is where clarity meets action, because memory loss isn't a mystery to fear, it's a message to decode. Here are the next best steps to take. Guided by what I've seen work over 3 decades, 1. Schedule a memory evaluation with a doctor who understands aging brains. Ask for a full cognitive assessment, not just a 5-minute screening, but a comprehensive review. This may include detailed history from both patient and family, physical exam, blood tests, cognitive tests like the MOCA or mini-cog, brain imaging if needed, MRI or CT. These tests help distinguish between normal aging, reversible conditions, and true cognitive decline. 2. Request blood work for reversible causes. Be sure the doctor checks for vitamin B12 levels, thyroid function TSH, electrolytes and kidney function, liver enzymes, inflammation markers CRP, ESR. Sometimes, a single imbalance can cloud memory, and correcting it brings clarity. 3. Review all medications. Many medications, especially those for sleep, anxiety, or allergies, can impair memory in older adults. Bring a full list to the appointment, including over-the-counter meds. Ask, is any of this possibly affecting their thinking? 4. Explore treatment options gently and gradually. If the memory loss is due to depression, poor sleep, or anxiety, treating those conditions can restore mental sharpness. If it's early-stage dementia, there are medications and lifestyle changes that may help slow progression. Remember, there's a lot we can't reverse, but there's also a lot we can still protect. 5. Encourage brain-supportive habits. No matter the diagnosis, the brain needs regular movement. Healthy fats like olive oil, fish, walnuts. Sleep routines. Social connection. Learning new things, yes. Even crossword puzzles count. These are not cures, but they're anchors in the healing process. Have you ever taken a loved one to get tested? What helped you feel prepared? Comment, "We've done this," or "Planning," now. In the final part, I'll leave you with a message of hope. What I've learned after 30 years of walking with families, just like yours. Because memory loss may change the story, but it doesn't erase the love. We've walked this path together, from noticing small changes to understanding possible causes to take real steps forward. If you've stayed until now, thank you. It means you care deeply about someone's mind and their future. Here's the truth I've learned in 30 years of working with families. Memory loss may change a life, but it doesn't have to diminish it. There's courage in early action. There's dignity in knowing. And there's healing in every question asked, every test taken, every caring conversation. Now, I want to guide you even further, because sometimes memory loss isn't just forgetfulness. It's the early whisper of Alzheimer's disease. That's why in our next video, we'll explore 10 warning signs of early Alzheimer's disease, a gentle step-by-step guide to recognizing signs like repeated questions, trouble with familiar tasks, subtle language or spatial changes. We'll talk about what those signs really mean, why catching them early gives more possibilities, and what you can do next starting today. If someone you love is showing early symptoms, or you just want peace of mind, this next video is for you. Comment below. I want to learn or share. I saw this so others know they're not alone. Thank you for trusting me with this journey. Thank you for caring enough to act, because in the end, all that matters is love, and that doesn't fade with time. It grows stronger